happen here with my YouTube?
I can just read you the questions.
Sorry. Okay. Good morning, everybody, and welcome to our weekly live question and answer series where we sit with an integrative physician, Dr. Rita Ellithorpe, and we look for questions from you, the audience, about any health questions, any health concerns. Of course, this is not meant to take the place, and it is not specific medical advice. We stress that it is important for you to maintain a relationship with your physician and ask them follow-up questions to what we discuss here today that's specific to you. Of course, we're accepting patients here both through telemedicine and in person, so you can make an appointment with us as well too to dig a little bit more into detail on your specific medical needs. But we love to just look for any and all questions that you may have. Of course, our expertise here is in prevention of disease, and building a strong immune system. That's been a big focus for us here on these webinars. But Dr. Rita Ellithorpe has decades and decades of experience in allopathic, emergency care, urgent care medicine, and she transitioned several decades over into preventative medicine, coming at health from a more holistic, integrative perspective. So you can use the chat section on the side of YouTube here and just post your questions there. I will be monitoring those and asking the physician these questions. You can also email your questions into us at office@tlcdoctors.com. We'll get those emails after the broadcast, of course, and I will ask those on the following episode. This week it didn't look like we had any questions emailed into us, and if you do email a question into office@tlcdoctors, just make sure that you put in the subject line Q&A, question for live YouTube, something along those lines, so those emails can be directed to me. Thanks for joining us, Dr. Ellithorpe.
Always a pleasure every Wednesday.
Yes, it is. All right, well, we'll hop in now to the questions. I see that we have already had one so far. Jennifer asks, you know that we can't hear them. Yes. My question is, how do you lower triglycerides naturally?
The triglyceride is a simple fatty acid that is generated when you eat more starch and fruit sugar and carbohydrates. When you eat more than your daily output and need to burn your sugars down for energy, your glucose down, the body will take those sugars and assemble them into a little fat droplet called a triglyceride. Mm-hmm. And triglycerides are the simplest form of fatty acids that the level of which reflects basically your burning of sugars and carbohydrates. So the natural way to have a lower triglyceride is to lower what causes them to be developed, which is carbohydrate, sugar, starchy foods. So exercise helps with your burning of your glucose as well, and helps you to burn and increase your metabolism. Saunas help you do that. We just strongly urge you to understand that your blood compartment, the vascular space of these blood vessels, the volume, has a certain capacity to take on sugar and triglycerides and things, and you can make your blood thicker, more sludgy, more sticky. If you eat excess carbs and starches and fruit sugars, and then the body is alarmed by the volume that's being absorbed through your gut into the blood, and it rapidly will try and make triglycerides for storage, and this is how you gain fat.
Right.
It also puts a burden on your liver, and these fats will start building up and get deposited in your liver as well as getting fat, but not exclusively. So you can appear well proportioned but have a fatty liver.
Right.
And we're seeing this a lot in children today. We're seeing it so much that the liver damage is occurring, and never before have we seen, or have I seen, as many children, adolescents have to go in for liver transplantation because they've damaged their livers with a cheap sugar, fruit sugar, juices drinking, soda drinking, cracker eating, chip eating, tortilla chip eating, French fry eating, lifestyle and diet, and inactivity.
Right.
So hopefully that'll answer your question.
What
Carbs
is
cause it.
So on an average patient, where do you like to see triglycerides on their labs?
I like to see them at 50 or less per deciliter, okay? 50 milligrams per deciliter or less. Now, the world, your lab, averages out the human population, and we assume that this is health. But Americans are obese, diabetic, inactive, chronically ill people, and using that as a laboratory average is ridiculous.
Right.
Therefore, decades ago, I abandoned the reference range that allows you to have a triglyceride level of 150 because that's just reflecting that you've jam-packed as much sugar and so forth that you possibly can.
Right.
The minute you eat, you're going to be busting out everywhere on your body for stress. The same with the blood sugars. I've seen labs allow it up to 126 milligrams per deciliter, calling that normal.
Right.
Now, I do see doctors and people starting to wise up with this keto move, but I preceded the keto move by decades. And I'm pleased, though, to see that they're balking at these things and asking such wise questions. So a blood sugar, I think that is the top limit before a doctor starts cautioning their patient that they are harming their body, is 85. If you stick your arm out and your blood sugar in the morning after not eating for 12 hours through a night's sleep, if it's above 85, you're on your road to chronic metabolic disease.
Right.
So 85 on the blood sugar, 50 on the triglyceride.
Okay. And just to wrap that up and to summarize triglycerides, if you walk in here and your triglycerides are above 50, what can we do to lower that naturally? It's diet, and of course exercise and lifestyle play a role into that, but you immediately have to cut out the simple carbohydrates and carbohydrates in general. Certainly stay away from sugars, absolutely away from high fructose corn syrup and these high fructose syrups. And believe it or not, when our patients come in here for the first time, they're actually often steered away from even fruits. We take them off of fruits because fruits have fructose in them, and not that fruits are bad, but add that onto the typical standard American diet where you're getting sugars and carbohydrates snuck in anywhere, and it's just adding gasoline to the fire. So we'll put patients on a very, very low, very extremely low carbohydrate diet, eliminating fruits, replacing the nutrition in fruits with something like Juice Plus, and we see those triglycerides drop very quickly.
Immediately, within a week, you can have this all turned around. And fasting, so we promote the concept that embrace the idea of self-denial.
Right.
Embrace that idea of self-denial and start learning to skip a meal.
Yep.
And skip breakfasts and just have a lunch and an early dinner. And then once you're compatible with that, then once a week at least, skip the lunch also. So you're skipping breakfast and lunch, and you're going from last night dinner to dinner the next day. And this is going to, and is well established with research, extend your life. We know that calorie restriction is life extending.
Yes.
That's why I do a 5-day fast twice a year. I don't eat a bite of food from Labor Day, which is always the first Monday of September, until that Saturday dinner, and the 1st of January until the 6th of January dinner. And that kind of compensates for the increased celebrations I do in the month of August. It's your birthday, it's my birthday, it's Dad's birthday, it's our anniversary, and then Labor Day we always have like a barbecue.
Right.
So within 1 month there's 5 celebrations, and I'll be honest, I'll have a little treat with that. But when I do the 5-day fast afterwards, my body recorrects to that. Yeah. I just did, of course, last month the 5-day fast, and And my triglycerides, I think, were 37, something like that. If you look, did you check on me? Normally my son checks on me. But you can see I'm a big woman, and still my triglycerides are excellent. And that's why my energy is excellent, my mental clarity is excellent. I have great sleep. You know, I'm able to do all this work without a bat of an eye. I'd like to see someone my age, almost 70, do as much as I do.
Right.
And work out, right?
Yep. Amen.
No, you've got to lower those carbs, and you can't judge a person for looking, I would say, full. I mean, somewhat, I feel bad for all these women who come in here and they look like they are big, strong women, and they would never fit into a size 12, okay, or even maybe a 16. But they're very strong, and their triglycerides are in the 30s, you know? And they're very healthy women. So you cannot just, the outward appearance, you know, get within reason,
right.
You know. You have to understand some people are built to be more like the Statue of Liberty. That's what I think I look like. Okay.
All right. Hopefully that answers your question, Jennifer. We have one now from Michelle, and she says, what does Dr. Elthorpe recommend for a daily intake of total carbs, fats, and calories for a 53-year-old woman who wants to lose 20 pounds but is healthy?
I would say I would restrict my carbs to 25 grams per day. That would be my top limit. That includes everything you eat. So
that's very low.
I know. I would, well, she wants to lose 20 pounds. She didn't give me a period of time, so I presume she wants to lose this within the next 2 months. Okay, so if we have 8 weeks and you're on 25 gram carb limit, and you do intermittent fasting with that, so you don't have breakfast ever, you just have a lunch and a dinner, so that's 12 and a half carbs per meal. And you incorporate that with exercise. I would do what we would call a limited high intensity intervals, where, let's say, 10 minutes once a day, you would do, you know, run in place and then sit on the floor and do 10 sit-ups, and then roll over on your knees and do 10 girl push-ups, then stand up for 1 minute, run in place, then sit on the floor, and try and work as many cycles of that as you can in 10 minutes. That's called high intensity interval training. Right. If you did, and nothing else, you know, if you did that, plus you drank your body weight, half of that in pounds, as ounces of water plus 10%, you should lose that weight. I mean, biochemically, you should lose that weight. Approximately 1.5 pounds to 2 pounds a week. So that's 8 pounds a day. She'll get about 16 pounds. If she can jumpstart this with a 2-day fast and not eat anything, just water or black coffee or black tea, that will accelerate that. I think I lost 11 pounds on my 5-day fast, if I recall correctly. Yeah.
And certainly you could incorporate into that some resistance training, lifting weights as well too. Obviously depending on your physical ability, but muscles are the engines of the body that, and as we build our muscles, we increase our capability to up our metabolism.
True, but if you want to know, I think the critical research shows that exercise is not what helps you or makes you lose weight.
Well, you can't outrun your fork, as they say.
Right, you cannot outrun your fork. So I think that 10 minutes a day will raise the metabolic rate. I think something like TLC metabolic formula, which helps burn down those calories. You could get a keto urine stick at the drugstore and test your urine every time you urinate and see if it's getting into ketones, then you know you're losing weight. That's why I like to kickstart things with a fast a day or two. Women don't have the muscle mass of men, so men usually get into ketosis on a 2-day fast. Women usually take 3. That's why I always do a 5-day fast. So when I do that.
Okay, so we talked about basically you're recommending an extremely low or a ketogenic diet, intermittent fasting, skipping breakfast, carbohydrate limit at about 25 grams a day for those 2 meals, kicking it off with a fast 2-3 or more days. And she also asked about fats and calories, and I think I know the answer to this, but I don't think we restrict so much on the fats or the calories.
No.
We focus on the carbs and the sugars.
Right. And it's because fruit sugars, starches, and healthy starches and carbohydrates and sugars all raise the hormone insulin.
Right.
Insulin is the fat promoting, damaging, blood vessel thickening hormone.
Right.
And it's your insulin level, which I've been testing for decades on my patient fasting, that is the harmful hormone in the American lifestyle system.
And healthy fats are going to be very satiating, help to make you feel fuller. They're also the right kinds of fats are anti-inflammatory. They help heal your cells and promote that cell turnover, and so we're not so concerned about the fats or even the calories. It's the carbohydrates that are the focus.
Right. The fat is known to be very satiating, and all the research endorses that. Whereas you eat carbohydrates, insulin secreted to clear that out of that blood vessel, which will drop your blood sugar. That's why people initially in life become hypoglycemic.
Right.
And they had this common little disease, they said in the 70s and 80s and 90s, I have hypoglycemia. Well, yeah, you'll have hypoglycemia on a high carbohydrate diet because you crash every time, because insulin will overtake it every time. But eventually, you'll have ruined your metabolism with this, where the insulin will become resistant and not able to keep up with your carb consumption,
Right.
and you'll move towards pre-diabetes, then diabetes, and all the damage involved. Fats do not create an insulin response. That's why it's smart to have a plan and know what are some good choices of fatty foods. So if I'm on a diet or a fast, I will have bacon strips that I've pre-cooked up. You know, in the house I'll have a whole plastic bin of bacon pre-cooked up. Hard-boiled eggs would be another thing like that. A low-carb celery stick with some Philadelphia cream cheese or cheese on it. So you have to be smart in choosing this. Another thing is I have cans of sardines. I have cans of anchovies that I will reach for. I enjoy the salty taste and all the oils that they're packed in. And I have the doctor's Doctor's Nutrition Bar. The Doctor's Nutrition Bar was designed by our team here exactly to have a high fat phospholipid, which are the membranes that make all the membranes in our body, and it has high protein in it. Protein can cause some insulin response, so you can overdo it by eating protein, but it would be difficult. So this is more on a theoretical side. But that's why we stress eat the fat. Butter, I even put butter on my steak. I'll put butter on my salmon. I'll put butter on my chicken. And I'll be liberal with butter wherever I cook with it and so forth, so that I'm always satisfied with the fat component. Carbs, fruit sugars, starches will never satisfy you, give you satiation. And I've always said to my patients here, good foods become bad foods when you've eaten too much food.
Yep.
Good foods become bad foods when you've eaten too much food. In general, we're talking about the sad American diet with all the carbs and cheap carbs, because it's cheap, therefore it's going to be marketed to you.
Yep. Okay, next question is from Jennifer again. She said, Dr. Rita mentioned recently that some of her patients have an Ivermectin prescription. Is Ivermectin just as effective for treating COVID if given after receiving a positive COVID test?
Yes, absolutely. Ivermectin, another let's see, what country? Slovakia has just announced as of yesterday that now their drug of choice, their treatment protocol is ivermectin for prevention and for both early and late treatment. So mild and early symptomology and the late course of the disease, ivermectin is their go-to drug there. The data is now coming out in volumes. Ivermectin is very smart. I think hydroxychloroquine is also a very good choice. It has to be taken for a long preemptive time. The half-life of hydroxychloroquine and the half-life of ivermectin are different. So ivermectin seems to have impact quickly, right, whereas hydroxychloroquine, if taken on a regular basis over time, is probably just as good preventatively. But as far as when you have the symptoms, I would go to ivermectin now with what I see in the literature, and the randomized controlled studies are validating this. So absolutely, she could have that. The dosing is typically, if you're about a 100-pound person, an adult, essentially, we will give for prevention 12 milligrams of ivermectin, and 2 days later another 12 milligrams, and then you stay on it every 2 weeks, 12 milligrams, every 2 weeks, 12 milligrams. Hydroxychloroquine is preventatively 200 milligram tablet twice a week. All right?
Okay.
So those are the doses. Now, if you have symptomology, you have the fever, the cough, the malaise and stuff, treatment with ivermectin is 12 milligrams a day for 5 days. Now, we might continue that, but your doctor should be following you and make a determination whether he wants to continue that for 7 or 10 days total.
Right.
But preventative early treatment is the key to this. Fortunately, it's very impactful on the later symptomology, the pulmonary phase, and then the late pulmonary phase. But timing is everything, so don't delay if you're concerned. Your doctor should help you with that, or with an early or a preventative dosing.
Right. Okay. Next question is from Barbara, and she asks, can a chelation IV before COVID-19 vaccine? So can you get a chelation IV before a COVID vaccine?
Absolutely.
I would do it immediately after. I would do it before, I do it after.
Afterwards.
Yeah.
Yeah. The COVID vaccine is an experiment. When you do this, you are entering into the phase 3, because they have really not finished phase 3. Phase 4 is the long-term, surveillance phase, and I have concerns about the science behind the vaccine with the new mRNA type treatment, and with all these remedies that we have, the quercetin, and that's in our D-hist, and I take 2 D-hist all the time for my allergies. Fortunately, it's very powerful as an antiviral. Taking vitamin D. The zinc I've always had in my multi-mineral vitamin. We made the TLC Energy Core, yes, or MitoCore, so the zinc is very valuable. The vitamin C, which we've always had, we have that as IV as well. The low-carb diet, always teaching my patients not to be obese and to keep the sugars down, because sugars depress your immune system. Right. Now we have ivermectin for early treatment, early phase of symptomology, the pulmonary phase and the late pulmonary phase, and then we have hydroxychloroquine. There is another medicine that has very good research coming out. Again, an old medicine, just like ivermectin and hydroxychloroquine, is colchicine. Colchicine is now being looked at as another repurposing of an old type drug. Now, that drug has more side effects than ivermectin and hydroxychloroquine, but that has very good research seeming to emerge now in randomized controlled trials. So why would I recommend something new and unknown with all the VERS reporting on it? That's vaccine related, episodes. Okay, there's such a burst of these as well as deaths. I am very glad that I did not recommend the vaccine at this time. With all this that we can do to help people, I feel confident I made the right choice in not recommending it at this time.
Mm-hmm. Okay. Next, so anything chelation IV related to that we want to touch on?
Well, EDTA chelation is an antioxidant. It enhances your microcirculation. It has the vitamin C in it if you take the enhanced one we've designed here. It is a great health enhancing method I do preventatively, vaccine or no vaccine. I do this all the time.
And of course, it's removing heavy metals.
Right, and I'm not sure if there's aluminum in these vaccines or anything like this as adjuvants. I'm on the side of thinking they don't have aluminum in them. But I think chelation, anytime you can get this done in our toxic world. Remember, I think, and I have a video on Tustin Longevity Center YouTube. If you go to that video I did a year ago called The Truth About Chelation Therapy, I think you can make a very strong case that the number one cause of death in this country is lead. But no one's talking about it because that's so politically sensitive and it would impact industry. I was just listening to a research PhD from Germany last night, the night before last, on aluminum. And he's making the argument that aluminum really is the number one cause of chronic disease in the worldwide. I think you have to be an advocate for your own health. I think your doctor has to get out of a specialty mindset and open his mind outside, or her mind outside of just their specialty, and look at how bad toxic metals are and how ubiquitous they are. They're everywhere. We're breathing them. Every one of us is breathing them in into our body with every breath we take.
Right. Okay. Looks like last question for now is, since we have to take Vascuzyme on an empty stomach, if that day I am not fasting, how long do I have to wait to be able to eat?
I would wait 3 hours in general. I think that's the best because the stomach empties in 3 hours. Yours might empty depending on what you ate before that time period, if it was a lighter meal, quicker, better, faster.
Right.
You might take orthodigestzyme to help empty your stomach sooner. But in general, it takes 3 hours to have an empty stomach. Now, mind you, you won't be harmed if you take it sooner, but the impact, the efficacy of the systemic enzyme will be somewhat involved in digesting whatever food is in your stomach, which is a good thing,
right.
Okay? But if you're wanting this to just be absorption for your body and all your other needs for enzymes, then you really would like to have an empty stomach. So I take mine all in the morning on an empty stomach, always. And if I'm feeling ill or my workout made my back tweak or something, or my knee, I will wait probably to my bedtime, and I try and stop eating at 6, so 9:30, 10 o'clock might be my second dose.
And if you take a second dose of it before you go to bed. Okay. And I've heard from the company that makes both Vascuzyme and Vitalzyme that the minimum you should wait is an hour before you eat. So I wouldn't take Vascuzyme or Vitalzyme any less than an hour before I eat, because then you're endangering those enzymes just being put to use as digestive enzymes instead of systemic enzymes.
Realistically, an hour is not enough.
Okay.
I don't care how healthy you are. I'm going to say bare minimum 2 hours.
Yeah.
Bare
so
minimum.
I keep mine right by my bedside, I sort of set out my morning vitamins, and I take them right in the morning. I drink those down, and then I go do my thing, exercise and such. And since I'm doing intermittent fasting like you, I'm usually not eating until noon, 1, 2, 3 o'clock anyways on most days, so that's plenty of time.
Talon will be here many years helping people if we live like this.
Let's see here. We're a little over time, but it looks like one last question came in. How do I get an appointment with the doctor, and can I have a long distance treatment prescription? Ophelia, from what we understand, we are only licensed in the state of California to practice medicine here in the state of California. So we do have patients that have flown in from all over the country and sometimes from out of the country to see our doctors here, receive treatment, receive prescriptions, but we're really not allowed to practice medicine out of state unless we are licensed out of state. So you need to either come here to see a doctor in person for an appointment. We really can't establish a relationship if you are out of state on a telemedicine platform, unfortunately, at this time. Maybe in the future we'll look at licensing in other states, but for now, our professional liability insurance as well as our state licensing guidelines don't allow us to see patients out of state.
If the people would have their healthcare providers go and look up Dr. Paul Marik, M-A-R-I-K. He's from Virginia Medical Center. He came up with the I-MATH protocol, I-MATH, and that stands for treatments like I is for ivermectin, M is for methylprednisolone, A is for ascorbic acid, T is for thiamine, and H is for hydrocortisone, which actually he's using methylprednisolone. But Dr. Paul Marik, M-A-R-I-K, and if you go on to Dr. Bean's YouTube, he's Syed Mobeen, M-O-B-E-E-N, Syed, S-E-Y-E-D, is his first name, Mobeen, M-O-B-E-E-N. He's another doctor. He's does a YouTube series on healthcare, and he has just interviewed Dr. Paul Marik again a few days ago. So if you put up in his search Paul Marik, you'll see all the lectures. Have your doctor listen to him. If your doctor is not convinced by the volume of research that is demonstrated there, I frankly would go find another doctor.
All right, well, folks, that is more than all of our time for this week's episode. We will be here next Wednesday. We're here every Wednesday at 9:45 a.m. Pacific. Tell your friends, tell your family. You don't have to be a patient here to ask questions and to interact with us. We thank you so much for watching today and for asking your questions. Much better than us just sitting up here and talking about a topic. And do us a favor, if you find this information valuable, please like the video, subscribe to the channel, and you'll be notified when we publish more videos, which we're doing more and more often now.
Yeah, and let me know in the comment section below if you would like me to do a longer 1 hour in the evenings, because I'm looking at opening up a channel or adding to this channel maybe 3 nights a week, maybe on a Monday, Wednesday, and a Friday, so that we can just be of more service to you.
Thank you, everybody. Thanks for joining us. We'll see you here next Wednesday at 9:45 a.m. Pacific. Until then, be well.